In this video, I'm going to talk about how creating a high-purpose environment can produce better results and help to build a better work culture. I tell the unlikely story of how a bacterium found in the dirt by a Japanese microbiologist, together with a purpose-driven organization, changes the lives of millions. Stick around for the scoop. My name is Eddie Boertes, and I'm the founder of Leadership. I work with leaders and teams to build an organizational culture where people thrive. What is the purpose of business? On September the 13th in 1971, the New York Times magazine published an article written by the Nobel Prize-winning economist Milton Friedman. It was titled, "The Social Responsibility of Business is to Increase Its Profits." This article formed the basis for his signature achievement, the near universal acceptance, at least in the world of business anyways, of the idea that a public company must maximize profits and shareholder value above every other goal. As we move well into the third decade of the 21st century, it is becoming more apparent that the world is a different place, and more people generally are looking for a different work experience. The aftermath of many corporate scandals, the consequences of the recent global pandemic, and the continued greed shown by many industries has woken us up to the fact that the world needs to change, that the future needs to be different. Generation Y and Z in particular are showing that they will hold corporations accountable for a greater sense of social responsibility and the creation of shared value with the communities that they operate in. Enter one of the heroes of our story, Satoshi Omura, a microbiologist and a bioorganic chemist at Tokyo's Kitasoto Institute. One day, while digging in the dirt near a golf course about 130 kilometers southwest of Tokyo, Omura discovers a chemical compound that would literally alter the lives of millions of people. You see, Satoshi spent his days hunting for new sources of pharmaceuticals. He knew that some existing drugs, including antibiotics, had been derived from chemical compounds found in nature, and he had developed screening methods to test for promising medicinal compounds. Digging in the dirt that day, he discovered a bacterium in the compound that was a new strain. Now, Omura had an agreement that he would send any promising compounds to the Merck laboratories in Rahway, New Jersey, for further testing and development. The Institute would receive royalties from any products that would be commercialized through the partnership. So it's 1978, and a team led by parasitology expert William Campbell starts testing the samples as potential treatments for parasitic worms. The culture taken from the dirt near the golf course is found to be extraordinarily effective at ridding mice of worm infestations. They isolate the active component that is produced by the bacterium, and they find that it's actually a combination of 8 closely related compounds. They begin modifying the compound by tweaking the molecular structures. They synthesize thousands of similar compounds, and they create a drug which they called Ivermectin. It's 25 times more potent than existing treatments for parasitic worms. With further testing, they find that it could be used to fight infestations by mites, ticks, and botfly parasites. It was effective in horses, cattle, pigs, sheep, and dogs, and was non-toxic to these animals. Ivermectin is commercialized as a veterinary treatment in 1981, and this is where our story gets interesting. The black fly breeds in fast-flowing rivers and carries the larvae of the worm that causes onchocerciasis, or river blindness as it is commonly known. When an infected fly bites a person, the fly deposits worm larvae on the person's skin. The parasites enter the body through the bite wound, where they mature into adult worms that live and breed. female worms release thousands of microscopic larvae that move throughout the body, including to the eyes, where they cause scarring that leads to blindness. Other symptoms include an intense itching, which leads to people literally tearing their skin apart, often committing suicide in sheer frustration. The disease is one of the leading causes of preventable blindness in the world. The disease affects millions of individuals in the tropical areas of Latin America, Yemen, and Africa. The World Health Organization estimates that there are around 100 million people at risk of contracting the disease, and that there are 34 million people infected, of which 800,000 are visually impaired and 270,000 are blind. The social and economic implications of the disease are massive, as you can imagine. Images of young boys and girls leading the elderly blind through rivers to work in the fields are not uncommon. Many young people move away from their villages and leave prime fertile land in favor of less fertile land further from the water, and many are left completely incapacitated by the disease, unable to make any meaningful contributions. William Campbell led the cause to study ivermectin as a possible treatment for river blindness. Trials begin in 1981 in Senegal, and after several years, the drug is approved for human treatment in 1987 under the name Mectizan. Although the final figures are not available, it is estimated that Merck Pharmaceuticals spent hundreds of millions of US dollars getting the drug ready for market. Because most of the patients who benefit from the drug are from developing nations, they knew that these patients wouldn't be able to afford the drug at any price, and no donors were willing to pay for it. If you take a drug like Mectizan to poor people, you don't make any money. There is no shareholder maximization. In 1987, Merck CEO Dr. Roy Vagelos makes the commitment to donate as much as is needed for as long as is needed. To date, Merck have distributed over 3 billion Mectizan tablets at a distribution cost of $5 a tablet. They treat tens of millions of patients annually. Now, why would they do that? Why would they pledge to donate as much Mectizan as needed until river blindness was eradicated globally? The answer to that question lies partly in the philosophy of George W. Merck, who took over the presidency of the organization from his father in 1925. We try to remember that medicine is for the patient. We try never to forget that medicine is for the people. It is not for the profits. The profits follow, and if we have remembered that, they have never failed to appear. This philosophy, together with a written down purpose to preserve and to improve human life, was a major contributing factor for this massive donation. The choice to donate Mectizan was made a long time ago. That's what your culture is. Your culture is the answer to the questions about what to do when tough questions and challenging times arrive. Because when those times come, you may not have the resolve then to make those choices. What kind of world do you want to live in? What kind of organization do you want to work for? With all the corporate greed taking place in the world, I know we can do better. We can decide what kind of people and businesses we want to be in this world. We can decide what kind of change we want to be in this world. That's all I have for today, folks. If you found this content to be useful or valuable in any way, please subscribe to my channel, hit the like button, and share with your network. I post content weekly on leadership and organizational culture. Until next time, cheers.